Hello and welcome to Beyond the Limits with me, Mike Forsyth.
And me, Matt Clark.
Good to see you, Matt. I'm excited today to be talking about a pretty hefty topic and one that we are definitely not going to be able to cover all facets of in one episode, but that is cancer. And we're delighted to welcome another guest today, where we're going to talk about cancer in general, so the current landscapes in cancer treatment, but also, as is the theme of this podcast, look at some of these alternative therapies that are permeating into the cancer landscape and are perhaps gaining a little bit of traction, and really look at those from a scientific point of view and hear from the expert whether they've got any benefit or not.
I had absolutely no idea about most of these. The algorithms that I obviously have on my social media aren't driving me towards cancer, thankfully, and that's probably for lucky reasons, but I thought this was really interesting to hear how wacky and wonderful this is, and having a credible insight or having an expert kind of break these down for us and explore these with us.
Yeah, totally. Now, the observant amongst you will notice that Matt is not asking any questions to our guest. Matt, I'm assuming there must have been some terrible medical emergency that you were called to, saving some lives that meant you couldn't make it?
Yeah, absolutely. That, or running out of petrol in my car and ignoring the flashing orange light, which meant I was about half an hour late to this recording with our generous guest who was donating his time from down under. So I actually joined the episode about halfway through, which meant the audio cut out and it kiboshed the whole thing. But what you managed to record with him early doors was superb.
Okay, perfect. Let's get started. Every 2 minutes, someone in the UK is diagnosed with cancer, and this stat is similar around the world. We're delighted to be joined today by Dr. Harry Gasper, an oncology consultant based in Queensland, Australia. Welcome to the show, Harry, and thank you so much for joining us so late in the evening down under.
Thanks, Mike. Thanks for the invite. Pleased to be here.
I wanted to ask generally about the current landscape when it comes to cancer treatment. So I think traditionally people would think about chemotherapy, radiotherapy. Has there been progress in this area, or are those still the fundamentals of treatment?
Well, there's been heaps of progress. I mean, I think it's fair to say that the last, particularly decade, but really the last 20 years, there's been a revolution in cancer treatment. And this all comes down to the unpicking of the mechanisms behind cancer. So we're still using surgery. I mean, surgery is still the mainstay of most, localized cancer treatments, and radiotherapy is sometimes used as well, particularly as, we're dealing with an older, potentially more frail population. Radiation has some great benefits there, as it's less toxic than an operation. But in the terms of, what I would term systemic treatment, so any tablets or intravenous treatment that we might use, has been great advances. And I think really we can point to sort of three different directions of advancing. So one of them is the advent of harnessing the immune system and allowing the immune system to take effect against cancer and unlocking some of the resistance mechanisms that cancer has against natural immune system attack. The second thing has been unlocking what we call sort of key targets or genetic mutations changes that might be the driver of why a cancer is growing, and blocking those with some clever technology, clever drugs. And then thirdly, there's more recently newer changes in chemotherapy. So, as you know, chemotherapy is quite non-specific and therefore has some side effects which can be life-changing. So some of the newer approaches have been to attach chemotherapy to antibodies, and in that sense make it more targeted. And that's got double benefits because, potentially you have fewer off-target side effects. So side effects related to, the chemotherapy just being in the wrong place. And secondly, it means you can deliver higher doses of the chemotherapy because in theory, the chemo is only going to go where you want it to go. So I'd say that those are the three main advances. And I mean, look, if we take lung cancer as an example, we've gone from stage 4 lung cancer being a tumor where it was almost guaranteed that you would not be cured, and the average lifespan was less than a year. And in some cases now, with some of the targeted therapy we have, for example, ALK or ALK mutated lung cancer, people are living. In fact, the sort of most modern studies, they haven't even reached the average survival yet, or median survival, what we call. So that's when 50% of people have reached their, end of life point. And, and those studies are ongoing. So that's been really revolutionary, and it's sort of changing this cancer into a chronic disease. And we're seeing that across a wide range of cancers, although unfortunately not all cancers.
Yeah, that's really good to hear. We're talking quite generally here, aren't we, about multiple conditions. And as you say, there are some where the progress perhaps hasn't been seen. It's twofold, isn't it? It's the developments in terms of treatments and the efficacy of these, but it's also the catching these cancers early, identifying them early, and that plays into kind of patient awareness, access to primary care, the whole lot of things that we need to consider.
Yeah. I think another important area of technological change in cancer has also been the advent of vaccines. So we know some cancers are caused by viruses. So HPV is the sort of famous example, and cervical cancer and some of head and neck cancer, which is caused by that HPV virus, is almost on the verge of being eradicated because of people being vaccinated at a young age. So that's been a real step in progress as well. So in prevention, I think it's worth mentioning, though, of course, that this is cancer is a global oncology problem, and so access to treatments, access to the right technology to diagnose cancers properly, access to these preventative vaccines is not universal. And so I think that's a problem that we have to face in the future.
There's been a lot in the media about the rates of cancer in young people, and that, I guess, is particularly bowel cancer, but the fact that these rates are increasing, and this is quite alarming. Do we know why this is? Is this something that is discussed in the oncology world?
Yeah, it's certainly of concern. It seems to be driven mainly in the Western world, particularly. I think the first thing to say is that it's important to stress that this is not some sort of rising epidemic that is affecting everyone. It's still small numbers, so your chances of getting cancer as a young person are still quite low. But the numbers, nevertheless, are certainly increasing, and that's at a sort of statistically significant rate. We're not sure why this is happening. Bowel cancer is the one which we're particularly seeing. There are some theories out there. There's a really interesting theory about a strain of E. coli, which may be related to the reason why people get young onset bowel cancer. But that's certainly only in the possible cause rather than proven paradigm at the moment. There's lots of other things that have been posited, like, changes in diet, the Western diet, perhaps, alcohol use and things like that. But I must say, some of those explanations I think are a little bit, not lazy, but I think it's not necessarily what we see in the clinic. So the young people with bowel cancer who I see don't tend to be people who are drastically unhealthy. In fact, quite the opposite, to be honest with you. And so I'm not sure that explains everything. The reality is it's probably a combination of lots of factors, as always with these things. Cancer is a disease primarily of disordered genes, so changes in our DNA. And changes in the DNA can happen for lots of different reasons. Exposure to toxins, bad diet. So I think it's really a combination of different things.
Yeah, and I think it is one of those news stories that I think does kind of find its way out into the general society's mindset. I mean, certainly I've had patients who come in and are concerned about this, and rightly so. And I think we as primary care clinicians, as GPs, have to perhaps slightly change our risk parameters and our thresholds in terms of who we investigate. I think previously, there's potentially the temptation to think, well, they're young, their symptoms are, fairly insignificant. This isn't going to be anything to worry about, and it's just being a little bit more alert to that. That's certainly my reflection on that. So as you know, in our podcast, we talk a lot about novel treatments, about new healthcare fads or areas where people are looking at maybe treatments from a different perspective. My feeling or my gut is that I imagine this is happening in the cancer sphere as well. People may be aware of shows and documentaries that have been on. Certainly, I've watched the program called Apple Cider Vinegar, based on a true story, and talked a lot about alternative treatments for cancer. Are you seeing any of this? What are the alternative treatments you see people promoting, and do any of them have any evidence?
Yeah, look, we see it a lot. And I think the first thing to say is that, medical oncologists in general are people who are empathetic and understand what it means to be diagnosed with cancer. And I think desperate people who are in a desperate situation will always look for whatever they can to help them. I think coupled with a society where truth is becoming hard to pick apart, it's understandable that people would, want to source potentially other sources apart from the sort of mainstream cancer treatments. And so we see it a lot. I think I pretty much get asked on a daily basis by at least one or two people for some either novel treatment that's not fully tested or something that's not considered to be something that we would use regularly. So I think the common ones, the top three at the moment for me are ivermectin. I asked a lot about that drug, which is quite an interesting drug, actually, but we can talk a bit more about that in a minute. I also get asked about vitamin C. I have a lot of patients who go off for their infusions of vitamin C. And a number of people ask about diet, and the ketogenic diet or alkaline diet is particularly popular amongst people undergoing cancer treatment.
Can we delve into those in a little bit more detail then? So you mentioned ivermectin. I mean, that to me immediately brings up memories of COVID and the treatments for COVID, that there was a big push at one stage that ivermectin was the answer to treat COVID. My understanding is that's been widely debunked now, but this obsession with ivermectin seems to have persisted, which I've never entirely understood.
Look, I agree. I don't know why. I mean, ivermectin is an anti-parasitic drug, commonly used in veterinary medicine, and, has an emerging role. And I think what it comes down to is this idea that perhaps effective treatments are being suppressed in order to, make financial gain or whatever. I think the reason why ivermectin's particularly grabbed the attention of some people is because there is some evidence that it might have some effect. It does have anti-proliferative effects, which is an important part of cancer treatment. And, some of the drugs that we use now do that. But I think the real key thing to say is that it just has not been tested or to the rigor that we would apply to some of the drugs that we use. You would not believe the amount of regulation that goes into a drug going from the bench, from a scientist developing it in a lab to being used in real practice. There's a huge amount of testing that has to be gone through. We have to report every tiny side effect that happens. And I'm involved in phase 1 trials in my work, and yes, this is it's painful sometimes, what we have to report. So so ivermectin, it doesn't have the rigorous phase 3 backing that we would like to see. And I think, to be honest with you, we may see a role for it in the future, but it will always be as a complementary drug to standard therapies. But certainly at the moment it has no proven role. And a key thing as well is that we don't know what dose is the correct dose to use. It does have side effects and can be fatal in some cases. So we have to be very careful using these drugs without the proof that they work.
Yeah, completely. And vitamin C, is there any evidence there at all?
I mean, again, this is another one of those, and this is what concerns me slightly about the rise of AI in academia, because there are studies from a long time ago which people got very excited about in terms of vitamin C and some of the potential anti-cancer effects it could have. But if you actually look at those studies, they weren't conducted with any rigor. There's lots of different cancers involved. The dosing is all over the place. And then more recently, the Mayo Clinic in America conducted some much more rigorous randomized control trials and showed no benefit. And in fact, there are reasons why vitamin C might be bad. Certainly in radiotherapy, the effect of vitamin C, it's an antioxidant, basically reverses the effect of radiotherapy, or certainly counteracts it.
Yeah, and the alkaline diet, it's interesting you mentioned that. That immediately made me think of what we discussed initially about rising rates of bowel cancer in particular, potentially being related to dietary reasons or ultra-processed food. It's interesting then that it's looked at as a change of diet being potentially solving a problem. Is that where this is coming from, or is alkaline diet, does that have any basis of truth?
Again, there's always a modicum of truth in vitro. So what we call, mice experiments or in a lab, there is certainly countenance to the fact that starving a cancer of sugar or making the environment more alkaline can increase the effectiveness of cancer treatments and can improve shrinkage of cancers. But it's very important to recognize that there's a very different landscape in a test tube or in a petri dish to a human body. And the reality is that a human body is very adept at keeping its pH, the acidity, where it needs it. And a cancer is very adept at making the environment that it resides in exactly how it wants it as well. And so no matter what you do to your diet or intake, your body probably will sort itself out. And I think the alkaline diet is particularly interesting because, I mean, the way that it's measured is that people measure a urinary alkalinization, so testing the urine to see how alkaline the urine is, and said, yeah, it's great, it's where we want it. But of course, that's just your body getting rid of the excess bicarbonate, which is basically proving that, in fact, your body's offloading all this stuff that you've put into it. So I think that one always makes me laugh.
And are there people who are asking about these treatments? Are they talking about that to be used in place of more traditional management, or is it just more a sort of curiosity in terms of how they can optimize their treatment in some way?
I think ultimately being diagnosed with cancer is a very humbling experience for every human being, and a lot of your autonomy is taken away from you. And so I think that's really what drives the thinking for most of these people who are faced with this situation. I think they go along to a hospital, they have all these tests done, they have needles stuck in them, and they are not in control. And I think seeking some other way of treating the cancer is a way of taking back control. So I think that's what drives most people. And of course, there's always going to be some people who, for other reasons, doubts or concerns about medical treatment, and that's normal. But most people, I think, are just coming from a place of desperation and loss of autonomy and wanting to get that back.
Harry, thank you so much for your time and for joining us on the podcast. So Matt, that was Harry, and some really interesting points there. We were having a few technical issues, so couldn't do the whole interview, but there's a couple of other topics that we're going to discuss briefly too. But I thought a really interesting topic.
Yeah, it was great to have him on, wasn't it? Having his insights into the specifics around the do's and don'ts of cancer care. Some of those things I hadn't even heard of as well. And it's interesting to hear some of the wacky and the weird and the wonderful things that obviously people are trying in those kind of desperate moments. And it was really interesting, I thought, when he mentioned about the lack of control that being diagnosed with cancer might lead to. And it got me thinking on how I would feel if I was diagnosed with cancer. And I thought, yes, I probably would be trying some weird and wonderful things, and how in that vulnerability, how that can be taken advantage of by certain social media campaigns. And I think it's important we touch on a little bit on the preventative lifestyle measures, because that's one of the bits that was cut out, wasn't it? And just summarising that for everyone, I think most of our listeners know that smoking is a terrible idea, and we're not going to preach on too much about this, but alcohol and obesity are definitely implicated more and more with higher rates of cancer, as is ultra processed food. And obviously not wearing sunscreen is always a bad idea.
Yeah, absolutely. I think worth summarising those. But actually what we did talk briefly about with Harry is potentially what people might know less about. And that's how effective lifestyle changes can be after a diagnosis is made. And hot off the press, there's actually been a fascinating study from overseas, from Canada, I believe, receiving some coverage in the mainstream media at the moment. And that suggests just how beneficial exercise in particular can be following a cancer diagnosis.
Yeah, when you sent this to me, I had to read it twice. I couldn't actually quite believe the stats that they were quoting. They're pretty powerful, aren't they? This study, it had 889 colon cancer patients across a number of countries. I think it was the States, Australia, UK, Canada, might have been Israel as well. But it randomly allocated half of them to a structured exercise program. So I think that was involving a personal trainer and a structured regime, whereas the other half just received a leaflet on lifestyle advice. Now, these people worked with a personal trainer over 3 years. There was guidance on the frequency and intensity, but I think they were allowed to choose the activities. But the stats of what's come back is compelling in many ways. So those who were given the structured exercise regime, for example, were given an exercise target of at least the equivalent to 3 to 4 hour long walks. But the results, this is where it gets juicy, it demonstrated 28% lower risk of recurrent or new cancers over the 8 years than those receiving the written advice only. That's 28% had less cancer over that same time frame. What do you make of this, Mike?
It's amazing, isn't it? I mean, I think We all know, and we have thought for a long time, that exercise has huge benefits. This is one that perhaps hasn't been touched upon previously, and I think that's why this has been so impactful as a study. A lot of the sound bites that are coming out of the press release of this is interesting, talking about how if these results were found in a medication or a drug, it would be shouted from the rooftops, wouldn't it? In terms of an absolute wonder drug.
Without any of the nasty side effects of drugs, this is just exercise, isn't it?
Exactly right. And I think really interesting quotes from the study's lead author, who I think summarises quite nicely, and I might just quote this, but says that after completing surgery and chemotherapy, about a third of patients with high-risk stage 2 and stage 3 colon cancer will eventually experience recurrence of their disease. And he says, this is Dr. Christopher Booth, he says, as oncologists, one of the most common questions we get asked by patients is, what else can I do to improve my outcome? And actually, as he reflects, these results now provide what looks like a very clear answer, that exercise in the form of an exercise program really can reduce the risk of recurrent or new cancer, alongside those other benefits, the fact that it can make you feel better and potentially help you live longer as well. And I think that's an interesting point, and it's a shame we didn't get a chance to ask Harry about this specifically, but I think the adage has always been that take it easy when you're undertaking these medications, these treatments. It's a huge undertaking. It's a big assault on the body. But actually it looks now as though being very proactive with your exercise and your health can have huge benefits. So I think a really interesting study, and perhaps we'll post a link to that in the show notes for anyone who wants to have a little look further.
And just to finish off there, I gave the stats on those who didn't get the cancer coming back. And this is the cancer recurrence or a new cancer. And when I say that it's the 28%, we're talking about for every 4 people, that's one less who's getting a cancer that's coming back or a new cancer in that time frame. We didn't actually mention that over the same time period, it showed a 37% lower risk of dying. So that is absolutely groundbreaking, isn't it? And it's nice. It's nice to actually put this, because we've always had this nebulous concept of exercise being good, but to now actually to be able to give this to patients as hard facts or hard statistics that's much more understandable. It's that benefit is so much more tangible, isn't it?
Totally. I think we should probably just add, clearly this is quite early days in the sense that this study has only just been done on specifically those with colon cancer. The feeling is from the authors as though this would be translatable to different forms of cancer, but this potentially paves the way to more studies on this, which is really interesting. I guess the final thing to say is obviously, before undertaking any of this, speak to your cancer doctor. Just make sure they know what you're doing, because clearly it has to be done in a safe and appropriate manner. But yeah, look, I think really interesting new paper, and actually very timely, because I think it marries up nicely with the topics that we've talked about with Harry today. So yeah, watch this space, I guess.
I'm going to finish off by just saying, if you haven't already, please like and subscribe to the podcast. Please follow us. It helps other people find us, and it helps us doing what we very much enjoy doing.